Thank you. Good morning. It is now time for the Ask the Derm segment. This is a really good one going into Thanksgiving tomorrow, joined by Dr. Billy Groff. Right, we're talking about the turkey neck, right? This where you just kind of want to walk around like this after you eat to make sure, right?
Exactly. Well, in the turkey, this waddle actually has a function. Not many people realize that, but a turkey can't sweat.
Okay.
So the way it cools itself off is there's a lot of blood flow through here, and it can regulate the blood flow to cool itself down.
Okay.
But it also acts as a tool for demonstrating sexual maturity. So for roosters, this is a good thing.
But we all sweat, and so I'm okay to not have that, right? So now, you're talking about four ways to get rid of it because we don't really need that. So.
Yeah, in human beings, it's unnecessary. So there's multiple ways non-surgically that we can address this.
Okay, this first one.
Yeah, this is called CoolSculpting. Now, this handpiece came out about a month ago, but it's been used overseas for probably a couple of years now. So what this does is it freezes the fat in the double chin area, and that freezing destroys the fat cells. So we have some before and after photos, and those photos are only after 2 treatments. So you can see a dramatic difference just 2 treatments, usually spaced maybe 3 months apart. So it's a great treatment.
And how much does something like this cost, like per treatment?
That's about $800 a treatment.
Okay, the next one is Kybella. I know we've talked about this.
Right, Kybella it's been on the market now for about 6 months.
Okay.
And this is an injection that breaks apart fat.
Okay.
So it's kind of like if you eat a fatty meal and it gets destroyed by the enzymes in your body. Well, this is an enzyme that will destroy and break up fat.
Okay, is this a faster, cheaper option than, say, doing the CoolSculpting?
That's a very good point. This can take anywhere from 2 to 4 treatments. So actually it does take, but it's very quick. If you look on our patient here, you can see there's a grid where her neck might have just a little bit of fat. So we use this tiny, tiny needle. It's super small, and we inject a little product all through that area.
Right. Does it hurt? Yeah, she's like, yeah, maybe a little bit.
Very, very tiny.
All right.
We can put numbing cream on there, she'll be fine.
All right, talk to me about the fourth one, Thermi?
Thermi, yes. So Thermi, this is a Thermi probe, just for demonstration purposes. And what this probe does is it goes under the skin, and I can adjust the temperature of this probe, and we actually melt the fat.
Okay.
And it actually causes tissue contraction or tightening as well. So you get melting of fat and tissue contraction.
So one here cools it, one heats it up.
Right.
All right.
This is a once and done treatment.
We're equal opportunity here.
That's right.
Getting rid of the turkey
we like
neck.
to spread it around.
Yeah. All right. Lastly is lipo. A lot of people have heard about lipo before.
Of course.
Right?
Now, back in the olden days, I say olden days, like maybe several years ago, they used to use these big cannulas to do liposuction.
Okay.
Well, there's a newer technique now. It's called Liposculpture. Liposculpture involves
much better, smaller needle.
Much better. Look. So liposculpture involves we inject numbing solution in here. The patient can be awake. No anesthesia required as far as general anesthesia. We pass this underneath the skin, and I can just gently suck out any of the fat in that area. And it's a once and done home run.
Wow, love it.
Yeah,
all right, are you going to end here the segment with our awesome turkey hat?
Does that mean you're going to put it on?
No, that means you're going to put it on. If you want more information, you can go see Dr. Groff at Laser Cosmetic Dermatology. Got to get rid of that double chin there.
Yeah, we'll take
all right,
care
we've got more news. We'll be right back on the other side of the break. I like it.
You're